morning, friends. This is a recording of case which was presented in HSH on 31st January. Recording could not be done at that time because signal was weak. So I'm re-recording the session. So this is a case of 11-year-old boy, Muslim boy belonging to a large Muslim family with his grandparents, parents, elder uncle, two cousin brothers, and one real brother, younger to him. His father is working on a ship, so he is not there all the time. He comes for the vacations, and he's quite attached to his elder uncle and aunt. So it is a very close-knit family. He's quite close to his brothers, cousin brothers also. Uh, okay, he had come to me for eczema. Eczema on buttocks, on legs, and on elbows, forearms. And he was given many remedies like Alkeria sulf, natramune, sulfur. So these remedies were given with partial recovery, and he had recurrent aphthe, for which again, he used to respond to acute, and then again recurrence used to be there. I couldn't, control the recurrence. I had tried to talk to him a lot. He never criticized his mother, whereas elder aunt had a lot of complaints about his mother. But he was okay with everything. So I was not getting any, maintaining factor as such. And this boy is you can say, a little pampered one because his cousin brothers are grown up and younger brother is just 3 or 4 years old. So for quite some time, he was the youngest one in the family. And he is good at studies. He likes to keep his notes properly, complete them, likes to attend school. He is good at, recitation of their prayers also, Muslim prayers and all that. He likes to do that. He likes to study also. But now because of younger brother, mother's time is taken away by him. And mother has to, adjust her timing according to younger brother's sleep routine or eating routine and all that, because of which he gets very angry and he feels that mother is not giving more attention to him and she's all the time busy with the younger one. So this is one thing. And overall, like, he's a good boy, you can say, sincere, not very extrovert. Like with PP also, he would answer whatever was required. Then his equation with brothers is quite good. He's close to his elder cousins. He likes to play with trains. He has that obsession with trains. He tries to search on net about different types of trains. He knows a lot about trains. Then he likes to play. If he's playing and somebody comes in between, like if he's putting the cars in line and if somebody has to pass through that, then he gets disturbed. He gets angry at that. And he's quite demanding. Like if he's watching a favorite program, he wants everybody to sit and watch with him. So he will not start the program till everybody has come. So everybody has to leave their work and come and sit with him to watch the program. Or again, he will make them watch whenever they are free. So this is one thing he is particular about. Then about food, he is not very fond of other things, but he likes non-veg and he likes biryani. So he eats that. And he always, tries to demand that only. Then this is about the total chronic picture, you can say. Now, in the present condition, when he came to me for this acute condition, in his family, his younger brother and other family members, they had gone for some wedding and everybody developed skin infection, impetigo. So everybody had, lesions. Few elderly people had very less, but his younger brother had, widespread. His face, his hands, his overall body was quite covered with, ulcerative, moist lesions, which used to look very dirty. So his younger son also had come to me only for his treatment, and he responded within 2 days. everything cleared out. People were worried and they told these people to take allopathy for quick recovery and all that. But the family has been there with me for many years, so they trusted me. And actually, it subsided very easily. So that was taken care of. And after that, this boy had. And this boy had worse lesions because of his eczema also, because at that time, all his eczema patches flared up. At the same time, his face, his forearms, his legs, everywhere there were lesions which were moist, oozing. So it used to look very dirty. Face also, I had posted pictures on the Telegram group. You can see the pictures on 31st January. So he had lesions all over. So his teacher told him not to come to school, and after recovery he should come with certificate from allopathic doctor. Now, because of eczema, in past also I had given certificates for him to request for allowing him to wear slippers instead of shoes, because shoes and socks used to aggravate his leg lesions. So maybe teacher had something in her mind, and she said you have to get the certificate from the allopathic doctor. So this was one thing. And his other children also, try to push him away. Ki, "Chi, ganda lag raha hai, so don't play with us, don't come close to us, we will also catch the infection." This boy was not bothered about that. But then this boy wanted that certificate so that he could attend the school, because he wanted to attend school regularly. He doesn't like missing school. So his school is in the afternoon. So if they came to me for medicines also, and if he would get late because of other patients, he would always tell his aunt and mother to go back without medicines also, because school time is there. They will get late for the school, so they have to go back. So he was very particular about his school timing and attending the school. So when he came, no, generally he doesn't talk from his side, but this time he was, as soon as he entered, he told me, my teacher has told me to get the certificate from allopathic doctor. So he is going on telling me this point again and again. बार बार वो बोल रहा था कि मेरे को ना टीचर ने बोला है कि एलोपैथिक डॉक्टर से सर्टिफिकेट लेके आना है, तो ही मैं स्कूल में अलाउ करूंगी, नहीं तो मैं स्कूल में अलाउ नहीं करूंगी. So I took it lightly. I didn't give much attention to that at that time. Then, after I explored, I was not getting anything PPP. So I talked to the aunt, I talked to the mother, no precipitating factor, no other stresses. So I asked, what is the reason? Like, why do you want certificate from the allopathic doctor? So he said, if I don't take that certificate, I will not be allowed. So I told him, okay. Then I asked the mother and aunt, did you take him to the allopathic doctor? So mother said, no, we did not take him. But then he was insisting that we should go to an allopathic doctor and bring his certificate. And if we are going, then we should also take medicines from allopathic doctor only. So I said, why? So they said he feels that with allopathic medicine, he will be better soon. So I said, okay, but then why should he, think about the treatment generally? He never said which treatment I want, which treatment I don't want. So I was wondering on that. So this was the PPP, and I have described the child also. So now you think about the case and post your understanding, and people have shared their understanding in the group. So I will be disclosing it. So, I had fallen in trap when I considered the chronic picture of playing with trains, monomania, or, forcing everybody to sit with him to watch TV. So I was just, not getting it. Medicine was not striking. So this time I thought of putting stress on PPP only, that is present, predominant, and prominent picture of the acute. And as it is, the situation was acute. It was acute with acute exacerbation of chronic also. So I gave it a thought. Then I was really, what stood out was this child insisting for medical certificate from an allopathic doctor again and again. And secondly, he said, if they are going to the allopathic doctor, then why not take allopathic medicines only? So these two things, which he never had told them earlier, struck me. And then I thought he was not bothered by the children not playing with him. He was not bothered about even others people saying that it is looking dirty and all that. But then he was bothered only that he should be allowed to attend school, and he wanted certificate for that. So what can be attending school for a child? Do we take it as a duty, sincerity, responsibility, ardency? So I was just giving it a thought. Then I thought, okay, for a child, this is his business which occupies him through the whole day. Most of the time, they are occupied with that. So this is the business for them. So business is not just, give and take or commercial aspect, but also the thing which occupies you. Like we say, mind your own business. So business is something which occupies you for a major time, and it is a purposeful activity. So for a child, purposeful activity which occupies him for longer duration of the day is his business, which is being a student, it is studies, right? So I thought of talking about business, that rubric I took. Second, I said, if we are going there, why not take allopathic? Because it gives fast recovery. So then I said, carry desire to be fast has to be taken. Then third, he was not bothered about his appearance. He was not bothered about children not playing with him. He was not about the skin should recover, come back to normalcy, become smooth again, become plain again without lesions. So he was not bothered about the recovery also. He just wanted to go to school. He should be allowed to attend school. That was his concern. So I took these three rubrics, and arsenic alb was the remedy which was common in all these three rubrics, because indifference to recovery, only two remedies are there, calcarea cup and arsenic. I gave him arsenic alb 30 single dose because it was a very acute flaring up situation. Plus he had this allergic background. That means sensitivity was very high. Generally in skin cases, it is better to give lower potency, especially when eczema is in the picture. Sorry, allergy is in the picture. So I gave arsenic alb 30 single dose. Within 2 days, he was much better, almost 40% better. And then after, subsequently, his acute lesions all subsided. Even the chronic lesions got very much better. And now very few lesions are left. Like even the original eczema lesions have subsided. Recurrence of aphthe has gone. I must have, given 2-3 doses after the interval of maybe a week or 8 to 10 days, you can say. And he's much better now, even in the chronic condition. So we have to see, like, if acute condition also, when the picture is very prominent and you are able to match it and find a really right simillimum, then you can cure the chronic underlying disease also, or the chronic underlying condition also. So this is one thing. So now we will go to the rubrics, because a lot of people had worked out and they have taken a lot of different rubrics, which I would like to clarify in this recording. So people had taken anxiety children in about schoolwork. That time I couldn't answer like why we can't take this rubric in this case. Now then, when I started thinking about them, then what is the important word in this rubric is schoolwork. Now what is schoolwork? Schoolwork is a guided work, or there is some instruction given, and then there is a time limit to it, that you have to finish your homework in 2 days or 4 days, or whatever project has to be completed in 1 week before the submission date. So it is a very well defined task where you are supposed to work and reproduce that work at a given time. So there are only 2 remedies, lipo and silesia, which we know for exam phobias, which we know for anticipatory anxiety, and along with performance anxiety. So that is the reason schoolwork is a very well defined task which has to be complete within a given time frame. So these people have anxiety about a task which is given to them, and they have to complete it properly. And properly means they have to complete it in a good quality, correctly, within the given time frame. So in this case, that was not the case. In this case, he wanted to attend school because he did not want to miss whatever was taken in the school, right? So that was his business, that he did not want to lose on whatever was taught in the school. So I had taken it business. Now people had taken proper. What is the difference between fastidiousness and properness? Now this patient is fastidious because he's fussy in eating also. He wants to complete his task. He wants to reach the school in time. He wants to do whatever is told to him to get certificate from allopathic doctor. So he's quite particular about that. Now proper is always according to the situation. Like if you are going for a wedding, you can't wear clothes which you wear casually. Or if you are going to office, you cannot wear uh, dazzling clothes like you wear for a function, for a wedding function or something like that. You can't wear bangles and you can't wear ghagra choli and go to the office. Similarly, situation has it is according to the situation. Like when you're talking to an elderly person, you have to talk as per that. So if you are sitting in an in front of other people, you have to sit properly. Now generally girls are instructed, sit properly with your legs tight, right? You can't sit with wide legs. So similarly, talk properly, listen to me. So it is more of as per the situation. Like किससे बात कर रहे हो तुम? बड़ों से बात कर रहे हो तो इज्जत से बात करो, छोटों से बात कर रहे हो तो मस्ती में बात करो, चलेगा, कैजुअली बात करो, फ्रेंड्स के साथ बात करो तो कैजुअली बात कर सकते हो. But when you are talking to an authority, when you are talking to elderly people, you have to talk in a particular with manners, good manners. So proper is according to the situation, right? So it varies. It is as per the situation, right? Fastidious is different because fastidious is according to what you like. Okay, I like non-veg. I like particular dish to be made in the particular way. Itna salt, itna mirchi, itna garam, itna thanda. Dress should be proper. It should be ironed properly. Now, proper for you, for me will be different, fastidious में. See, मेरे लिए एकदम कड़क इस्त्री चाहिए तो मेरे को कड़क इस्त्री ही चाहिए. So this is the fastidiousness. If thing has to be kept in this way, it has to be kept in this way. Fastidious is according to my choice. Proper is according to the situation, what situation demands. Then there was one thing, impressionable. Now in this case, if you take impressionable because teacher said that you have to get allopathic certificate, then you have to think, what was that certificate? It was not impressionable. Impression is when you are soft and you carry an impression. Like on a clay, you can make an impression, right? And that impression will remain even if it hardens, right? But in this case, getting a certificate was a permission to attend school, right? So it was not impression, but it was a requirement. It was a requirement for continuing school. So here it is not impression, it is the requirement or a लाइसेंस चाहिए स्कूल जाने के लिए, इस परमिशन चाहिए, उसके हिसाब से आपको वो जरूरी है. Then learning desire for. Now learning desire for is not attending school. Learning आप घर पे भी बैठ के कर सकते हो. Learning desire is if you want to learn something in depth, like we do. Now we are learning rubrics, right? So this is learning that you want to know everything in depth with good understanding in details. So in this case, attending school, doing properly the school work was important. Then people have taken ardent. Again, ardent is not equal to attending school. Ardent is a passion. You are working passionately for whatever interests you, right? So ardent has passion in it. It is not that he was ardent about, his school work. He searched different books and he did it. Nothing like that. Gourmand. People have taken gourmand. Gourmand में क्या होता है ना कि people शौकीन होता है, खाने का शौक है, तो ये पर्टिकुलर चीज खाने का शौक है. यहाँ का कबाब बहुत अच्छा होता है, यहाँ की चाट बहुत अच्छी होती है. तो इट इज gourmand is they want to try good food, they have good taste in life, they want to enjoy. In this case it was preference, matter of preference ki he liked non-veg, he liked biryani. It was not that he was a foodie and he wanted to eat different things or he wanted to enjoy a particular dish only. It was that he preferred these two things over other things. Then people had taken ambition increased means employed every possible. इसमें ambition कहाँ से आता है ना? He wanted to get better, get a certificate, not even get better, get a certificate so that he can attend school. So it was a requirement that he had to fulfill to attend the school. Attending school was his daily business. So I did not feel it was ambition and means employed every possible. मतलब खाली homeopathy, allopathy में means employed every possible कैसे हो गया? And he was not even saying that I have to get better. अगर ambition उसका certificate लेने का है, उसके लिए वो means possible try कर रहा है, तो भी वो क्या कर रहा है? खाली माँ को बोला, आंटी को बोला और डॉक्टर को बोल रहा है. आप मतलब वो ambition जैसा लगता ही नहीं है. It is a basic requirement to get entry into the school. Then people had taken antiques playing for when he was insisting that everybody should sit with him and to watch TV. So then when I asked why he has taken antiques playing, because he felt the child was throwing tantrum. Now throwing tantrum is a different thing from antiques playing. Throwing tantrum is like a manipulation. They will children will throw tantrum to get their demands fulfilled. Okay, if they want chocolate, if they want to buy a toy, वहां पे ही पसर जाएंगे, बैठ जाएंगे, रोना चिल्लाना चालू कर देंगे ताकि पब्लिक आए, लोग देखें, पेरेंट्स एम्बेरस हो कि हमारे बच्चा ऐसा कर रहा है पब्लिक में, और वो उसकी डिमांड पूरी कर दे कि जरा दिला दे, उसको शांत करो, लेके चल, 10 जन देख रहे हैं. So this is like throwing tantrum is to get their demands fulfilled by creating a scene where you will embarrass people who are handling you or caring for you. And antiques playing is opposite. They want to entertain you. They want to get your attention, get your eyeballs. Okay, so मुंह बनाना, चिढ़ाना, थोड़ा सा कुछ मस्ती करना, so that people like you. कितना मस्त बच्चा है, देख कैसा कर रहा है. So you get a lot of videos, funny videos of children where they have funny actions, they have funny speech, they have गुलाटी खाएंगे, कुछ ऐसा करेंगे कि आप उसको देख के आपको अच्छा लगेगा. You will be entertained. उसको बोलते हैं antiques play. Then people had taken elements from excessive study. Now इसमें excessive study नहीं है. इसमें जितना required काम है, जो काम चाहिए वो आपको करना है, और इसको उससे एलिमेंट्स फ्रॉम नहीं हुआ है. उसने ऐसे नहीं बोला कि एग्जाम के टाइम पे मैंने बहुत पढ़ाई कर ली, उसके बाद में उसके ये एलर्जी का एक्सासिपेशन. तो यू हैव टू ऑलवेज फील व्हेन यू आर टेकिंग एलिमेंट्स फ्रॉम रूब्रिक, वहां पे कॉज एंड इफेक्ट रिलेशनशिप होना बहुत जरूरी है, और एक्सेस इज मोर देन व्हाटएवर इज रिक्वायर्ड. और यहाँ पे ऐसा कुछ नहीं है, उसको स्कूल जाना है, रेगुलर स्कूल वर्क जो करते हैं वो उसको कंप्लीट करके देना. So this is the way I'm explaining the rubrics. Now remedies which had come up are Silesia. Now Silesia is very sincere. Silesia is very shy in public. Silesia and Lyco both are very shy in public. In Silesia there is lack of confidence, lack of grit. So ये जो बच्चा बार बार आके बोल रहा है कि मुझे सर्टिफिकेट एलोपैथिक डॉक्टर का चाहिए, उतना तो वो काम साइलिशिया नहीं करता. Similarly, Lyco is hard on inferiors and soft on superiors. Here in this situation, I am definitely an authority, a person on higher position. So he should have been soft with me. Naxwamika. Naxwamika is short-tempered, irritable, ardent, बट उसका क्या होता ना कि मुझे जल्दी ठीक करो, इम्पेशंस कब आता है जब वो काम नहीं कर पाते, उसमें आर्डेंसी है। वो आर्डेंटली कुछ टास्क करना चाहता है अपने हिसाब से, फास्टिडियसली और बहुत पैशनेटली, और उसके बीच में अगर कुछ आता है तो ही गेट्स वेरी एंग्री। अगेन नक्सवामिका में, बिजनेस में आई थिंक नक्सवामिका नहीं है, बिकॉज दे आर पैशनेट अबाउट द टास्क दे इंजॉय। उसका बिजनेस वैल्यू हो नहीं हो, वो जरूरी नहीं है। if they can spend hours on a particular design without thinking when they have to give it, बिजनेस वाला होगा कि ये मेरे को ये टाइम पे देना है तो मुझे देना है, तो ताकि मुझे और ऑर्डर्स मिले। नक्सवामिका विल टेक हिज टाइम टू प्रोड्यूस दैट क्वालिटी वर्क, ज्यादा टाइम लग जाएगा चलेगा, लेकिन मुझे वो काम अपने सेटिस्फेक्शन तक खत्म करना है। वो थोड़े ऑर्डर्स लेगा लेकिन क्वालिटी ऑर्डर्स देगा, और क्वालिटी उसका आउटपुट रहेगा। सो दे डोंट थिंक अबाउट आई शुड टेक 10 ऑर्डर्स, किसी भी तरह से करके दिया और पैसा कमाया, वैसा नहीं है। they will fulfill their passion, they will produce quality work, they are very fastidious about it. कार्सिनोसिन प्लीज करेगा, कार्सिनोसिन चिल्ड्रन आर फ्लैटरर। आपको कॉकेटिशन है, वो आके आपको, डॉक्टर मुझे प्लीज आप सर्टिफिकेट दे दो कि क्या, मैं वो सर्टिफिकेट दे दूंगा क्या, देखो ना आप मम्मी को समझाओ ना कि वो डॉक्टर, एलोपैथिक डॉक्टर का सर्टिफिकेट चलेगा तो वो दे देंगे। तो दिस विल बी द वे कार्सिनोसिन विल ट्राई टू टॉक टू यू। लैकेसिस में अम्यूजमेंट है, उसको तो स्कूल नहीं जाना पड़ा तो और ज्यादा खुश, घर पे बैठ के मस्ती कर सकता है, उसको जो इंजॉयमेंट करना है वो कर सकता है। फास्टिडियस लैकेसिस कभी भी ऑर्गेनाइज नहीं होता है अपने काम में, फास्टिडियस में नहीं है। लैकेसिस इज डिसऑर्गेनाइज्ड, उसके लिए तो एंजॉयमेंट ही काफी है। कालिका, कालिका इज इन टू प्रॉपर, लेकिन अगेन कालिका इज चेंज वर्जन टू, कालिका इज डॉगमेटिक। ऐसा कुछ पिक्चर ये बच्चे में नहीं दिखा। इसको मेन उसका प्रॉब्लम ये था कि मेरा जल्दी से ठीक कर दो, मुझे सर्टिफिकेट दे दो, ताकि मैं अपने स्कूल जो मेरा रूटीन चल रहा है, जो रूटीन एक्टिविटी है उसको मैं कंप्लीट करूं, उसको कंटिन्यू करते रहूं। ना इसमें कालिका की सेंटिमेंटालिटी है, ना कालिका का और कुछ है, पता नहीं, आई थिंक टू प्रॉपर या फास्टिडियसनेस वजह से कालिका आया होगा लोगों के दिमाग। आई थिंक मेरे हिसाब से मैंने कंप्लीट किया है। फिर भी आपको क्वेश्चंस होंगे तो आप कमेंट्स में डाल सकते हैं, या ग्रुप में डाल सकते हैं, या मेरे पर्सनल नंबर पे भी आप कम्युनिकेट कर सकते हैं। थैंक यू।